that there is no one certain roadmap, that there are going to be bumps in the road. There could be complications. In my case, when I had the surgery, I went there and the doctors were great. They really made me feel comfortable. They made me feel like they knew what they were doing. And obviously the fact that I'm still here means they did. But the doctor said, I'm going to give you something that makes you feel like you had a few drinks. And he did. And I did feel like I had a few drinks and I kind of drifted off. So the first surgery was fine. Woke up the next day, actually posted on Facebook with a picture of me holding my thumb up, saying, okay, I got this. This is great. Unfortunately, a couple of days later, I ended up with a thoracic infection, double pneumonia. I had AFib. I was on a ventilator for a week, and they put me in an induced coma to try and find an antibiotic that would work against the lung infection that I had. So I was in the hospital for 30 some days. When I got done with all of that and I began recovering, they gave me the results of my pathology, and I had 7 out of 17 lymph nodes that were positive. So I had to have post-op chemo, 12 FOLFOX treatments, cisplatin, oxaliplatin, and 5-FU. You'd get the 4-hour IV of the cisplatin and oxaliplatin, and then you would wear a pump that would pump 5-FU through your body for 48 hours, and then a home health person would come and take it off at the end of the week. Those treatments, because they had occurred so close to my surgery, because as soon as I got back, they started this treatment, they were really a struggle. I had a lot of trouble getting through all that. Of course, I wasn't eating. I had a feeding tube. I had a chemo port. I had everything that all the other esophageal cancer patients had. And so that was the hardest part of the surgery. Just because you have complications from surgery, which a lot of people do, that doesn't have any real indication on your long-term survival prospects because of the esophageal cancer. I'd rather have a much more complicated recovery from a more thorough surgery than a seamless recovery from a surgery where the margins weren't clear, they didn't get all the lymph nodes, or they didn't get enough information to give me a good diagnosis afterwards. When I got home and I was doing the treatment, as time went on, I started feeling better and better about my long-term survival. I started doing more exercising again. I started playing golf, and I would say that about a year after my initial diagnosis, I had gotten to the point where I could live my new normal life. I eat smaller meals more frequently, but I'm thinner. I can tell you this. I was 217 pounds when I got diagnosed, and I'm svelte 168 right now, and I feel very good. My body mass index is 21.1, which is better than it's ever been. I still run. I can do dips. I can do push-ups. I'm in pretty good shape. And in a relative comparison, I'm extremely lucky compared to some of my peers.